What is the history of Medicare Part A deductibles? Imagine a time when hospital stays cost just a few dollars a day. That was the reality when Medicare first started in July of 1966. Back then, the deductible for each hospital stay was only $40. This amount covered the first days of inpatient care during a benefit period. At that time, nearly all Americans aged 65 and older, about 19.1 million people, were eligible for Medicare. Over the next few decades, healthcare costs rose steadily. During the 1960s and 1970s, the deductible increased gradually. By 1997, it had grown to $760. That was almost a 19 times jump from the original $40. These increases reflected the rising costs of medical treatment and hospital care during those years. In the early 1980s, Congress made a big change. In 1983, they moved from a system where hospitals were paid after treatment based on actual costs to a system where payments were set in advance. This change aimed to control costs but did not directly affect the deductible amount. Moving into the 21st century, the deductible kept climbing. By 2018, it reached $1,340. In 2023, it was set at $1,600 for each hospital stay. These increases are mainly due to ongoing inflation and higher hospital costs. Looking ahead, the trend continues. For 2024, the deductible was $1,632. In 2025, it increased by $44 to $1,676. The forecast for 2026 suggests it will go up again to $1,716. It's important to understand that the deductible applies to each benefit period, not just once per year. A benefit period begins when someone is admitted to the hospital and ends after they have not received inpatient care for at least 60 days. So, if someone is hospitalized more than once in a year with a break of 60 days or more, they could face multiple deductibles. This deductible covers the first 60 days of inpatient hospital care during each benefit period. After paying this amount, Medicare starts to cover most costs, but there are still co-payments for days 61 through 90. For longer stays, higher co-payments apply for the lifetime reserve days. Many seniors have supplemental insurance plans, often called Medigap plans, that help pay all or part of the Part A deductible. As deductibles have grown, these plans have become more important. However, changes made in 2020 limited some new Medigap options for new Medicare enrollees. The history of Part A deductibles shows how Medicare has tried to balance providing hospital coverage with managing costs. As the deductible has increased over time, many seniors have needed to plan carefully and consider supplemental coverage to help with these expenses.